Heart failure traditionally had multiple types, but in recent years, we use very simple classification for chronic heart failure. Something heart failure with reduced ejection fraction. That means it is a moderate to severe heart failure. And then another group is something called heart failure with preserved ejection fraction, where the heart is stiff, otherwise pumping satisfactorily. Recently, to bridge a gap between these two types, there is a new introduction that is called heart failure with mid-range ejection fraction. Just to say that in between that could be patients, they fall into that group. Yeah, heart failure patients can be symptomatic, but heart failure can also remain completely symptom-free silently until it is diagnosed. Most of the time, patients come to the hospital only when they experience symptoms. The commonest symptoms are breathlessness, particularly on exertion or as the disease progresses, even at rest. Apart from the breathlessness, they can experience a swelling of their legs, right? Or the swelling can extend up to the abdomen, or generalized swelling as a fluid collection called as edema. In addition to the two, some patients in early phases can notice they would prefer sleeping at a particular height. That is what we call orthopnea. It is depending upon the physician. Whenever they try to lie flat, they become more breathless. They readjust the position with the multiple pillows. Sometimes that can be an early symptom. Whereas some others with advanced stages wake up in the middle of the night with breathlessness, suddenly from sleep with fluid coming into the lung. And then as they sit up, slowly the symptom goes away, and then they will feel better, and they may just decide to wait. So symptoms can come in multiple ways. These are common symptoms, but there are some other uncommon symptoms for heart failure, which is patients experience chest tightness as a cause that leads to the heart failure, or they can experience abnormal fast heart rhythm causing palpitations during heart failure. It is also not uncommon for heart failure patients to present with dizziness because of the change in the blood pressure due to the heart failure. So heart failure can present with multiple symptoms, commonly breathlessness or swelling, and not uncommonly completely symptom-free. That's a good question. Heart failure usually, once it reaches severity, it can progress rapidly unless we intervene. In the past, we used to predict heart failure progression can be rapid, and the prognosis can limit somebody's lifespan to 5 years. However, over the past 2 decades, with the varieties of available treatment, the lifespan has improved, and it is not uncommon to see heart failure patient living more than 2 decades. That's 20 years plus. Absolutely. So what it is we discussed about heart failure types, symptoms, and all. So now you are going towards its causes: high blood pressure, diabetes, body weight, aging. Everything can lead to heart failure due to other conditions. Of course, we as human beings can't stop this aging, right? But we can controllable diseases like a high blood pressure and diabetes. By keeping a healthy lifestyle, we can maintain our body weight, which will reduce the burden. So the high blood pressure can result in either of the heart failure with reduced ejection fraction or heart failure with preserved ejection fraction. So it can lead to any time. And similarly, diabetes mellitus. Whereas lifestyle-related heart diseases like heart attacks or ischemic heart disease can lead to heart failure with reduced ejection fraction because it affects a big group of heart muscle. So the heart muscle once die, it reduces the pumping ability of the heart. Oh, there are many treatment available for a heart failure. Now we have very structured treatment, something what we call as a definitive treatment or the pillars of heart failure therapy. We commonly believe there are four pillars to the heart failure therapy, particularly for heart failure with reduced ejection fraction, where it is moderate to severe heart failure. We actually treat them with a group of medicine called angiotensin converting enzyme inhibitors, otherwise commonly known as AC inhibitors. Patients may know the names of medicines like ramipril, enalapril. The medicine ends with the name pril, right? That indicates that's a group of medicine. This is the most commonest group of medicine that initially shown a lot of benefits in minimizing the progression, improving the quality of life, and reducing death and hospitalization. However, over the last 4 years, there are new developments in the field, and there is a new group of medicine called ONIs, which is combination of two medicine, a medicine called angiotensin receptor blocker, and then another medicine called nephrolysin inhibitor combined together, and it is used. It is a combination of medicine called sacubitril and valsartan combined together. It is available in one single trade name called Entresto. Right now, it's commonly used. It is reducing the hospitalization and mortality and progression of the disease more better than the traditional medicine ACE inhibitor. That's one. The next group of treatment is with the medicine called beta blockers. There are very particular beta blockers which are used for heart failure. The commonest are a medicine called bisoprolol and a medicine called covidolol and or metoprolol or recently nebivolol in elderly patients. These are the only four beta blockers we use for heart failure management. In addition to the two, there are another group of medicines called mineralocorticoid receptor antagonists. Uh, they are like diuretics, but they spare potassium, so they are also popularly called potassium-sparing diuretics. There are two medicines in that group called spironolactone, traditionally used in heart failure for more than 30 years now, and then another medicine called eplerenone, which is being used in heart failure for nearly 20 plus years. So both these medicines reduce hospitalization and reduce mortality. Recently, to add like a jewel on the crown, there is a new medicine group which is called an SGLT2 inhibitor, which is commonest medicine used treating diabetes patients. It was coming into the market since 2012, and on further researches, it is very obvious that these medicines are helpful in managing heart failure patients, whether they do have diabetes or they don't have diabetes. That means it is a single medicine that can be used for any patients with a heart failure. And very interestingly, this is the only group of medicine which has been proven to be used in heart failure with reduced ejection fraction, which is group 1, and a heart failure with preserved ejection fraction, which is group 2, two types of heart failure. In addition to all these, whenever patients come to us with shortness of breath or leg swelling, we do use diuretics, which are water tablets, to get rid of the fluid out of the body as a temporary immediate relief measure, which can be stopped later on. It's a good question. There are, as I mentioned, there are types of heart failure. When the heart failure is a severe type, and particularly a measure called ejection fraction is much reduced, we look at the ECG of the patient. If the ECG of the patient shows that the top chambers and bottom chambers, right, and the way it conducts, particularly when there is something called conduction delay, where the communication of the electrical impulses from the top to bottom is delayed, and also at the same time, There's a delay between the right bottom chamber called right ventricle and the left bottom chamber called left ventricle. Then it is that is a time the device therapy is very useful. So what we mean is the electricity doesn't go to the left bottom chamber, but it goes to the right bottom chamber and travel through the muscle to the left side. So there is a delay for the information reaching the left bottom chamber to produce contraction. So in those circumstances, if we go and give them a very special pacemaker, which is called biventricular pacemaker or CRT devices, that is called resynchronization, making the information reach the device, make the heart to contract at the synchronized fashion to improve the pumping ability of the heart. That is one. If somebody is, in addition to that, we commonly recommend a shocking device to be added to the pacemakers, this special pacemaker, so that if at all patient gets life-threatening abnormal fast heart rhythm, the shock can be delivered that terminates abnormal heart rhythm that makes anybody to live longer. So these therapies are now commonly used over the past 20 plus years. In addition to that, there are bridge to transplantation, particularly if somebody is young patients with a heart failure. We can select patients who need a heart transplantation and then refer them for some sort of mechanical devices called assist devices, right? They are like bridge to the transplant.